I only answer questions that are asked of me. I don't say this is why I'm eating, because when I was first diagnosed, I went to a diabetes education seminar through the military at the facility we lived at, and they literally lambasted the ketogenic diet, and carnivore wasn't even mentioned. But one of the other patients in the education room asked, well, wouldn't it be a good idea to go on a low carb diet? And got publicly shamed in front of the whole class. And so I was like, well, that put a really bad taste in my mouth for wanting to tell people, like, well, I eat in a way that makes sense for my own body. I found something that works. I just take my numbers in, I take my CGM, I show them my stuff, I tell them how much insulin I'm using. They're like, oh, your A1C looks really good. We'll see you in 6 months. And I'm like, okay. And I just leave because I don't really want to tell people much.
Okay, good morning, everybody. Hope you guys can hear me okay. We got Heidi in today as our guest today. Heidi, can you hear me okay?
I can hear you great. Thanks.
And likewise, I can hear you. Well, thank you. Where are you located?
I am in Yorktown, Virginia.
Yorktown, Virginia. Okay, very nice. Tell me a little bit about yourself then. I guess that's the point of this. So tell us a little bit about your background.
Yeah, absolutely. So I'm excited to be here. My husband is actually also Army. So hua from him. I am 52 years old. And when I was pregnant with my second child in 2009, I was what they call advanced stage, I guess, which is crazy. But I should back up and say that when I was little, my dad suspected I probably had something like hypoglycemia. It was never diagnosed. But when I was pregnant with him, I had gestational diabetes, like a lot of women do. And, it's funny because when I had him, the first meal I had after he was born was like, I'm not kidding, like a plate of like Lorna Doones and Cheez-Its. And I was like, what is this stuff? And they're like, well, you're not diabetic anymore. You can eat it. So, which, in and of itself is crazy. But, fast forward 3 years to 2012, and I was actually diagnosed with full on, what do they call it? Mature adult-onset Type 1 diabetes.
Okay.
So, started out eating paleo. I had 2 small kids, super hard to really stay on track. And I was dealing with a ton of like food addiction type stuff. Although if you asked me then if I was addicted to certain types of foods, I would have said absolutely not. When I was pregnant with my son, I did crave like pizza and bread and stuff like that. So it was a recipe for disaster potentially. But anyway, my goal has always been to have normal blood sugars. So I told people I don't want to lose my toes. Mm-hmm. I want to be able to see when I'm old. Things like that. Like people don't really recognize. They're like, well, a normal life to most people is having pizza. But I was like, no, to me now, a normal life is like having my fingers. So in 2018, I had basically had trouble those 2012 to 2018, really getting a hold of my blood sugar. And even though if you asked me what my A1C was, it would have been like 5.3 or something. But I had a lot of lows, like significant, severe lows, which of course is not ideal when you're trying to, when you're trying to deal with blood sugar, at any age, but especially when you have little kids and your husband's military and he could potentially be halfway around the world, something happens to you, anyway. So in 2018, I had a very well-meaning friend who recommended I do I don't want to name the program because they have a program out there, but a vegan, low fat, no oil, whole food, plant-based diet. Mm-hmm. And I was like, well, what do I have to lose? Like my goal has always been good blood sugar. So I started doing that in 2018.
Yeah, it sounds like the mastering diabetes paradigm.
Yes. Yes. You said it, not me.
Yeah, I know that.
So yes,
I know that one. Yeah, sure.
Yeah. So, I was literally like, well, by 2020, 2021, I was like, she doesn't have to live in my body, but I was exhausted all the time. I had a lot of inflammation in my gut. Focus was a problem. I had all of the brain fog that I've heard you talk about. Like I had all of that. And to make matters worse, I I started to have joint issues, which I didn't expect. Like people from the vegan community never tell you that you're going to have joint problems, but I started having trouble going upstairs, and I'm like, I'm not that old. I may be in my 50s, but I have a long life to live, and I can't hobble down the stairs for 50 years. Like that's not gonna work for me. So out of desperation, I first went into keto, but then I started to see videos about carnivore. And I consider myself fairly good researcher. So I was like, well, of course, low carb is going to be good for someone who deals with diabetes. And I followed Dr. Bernstein. I've had his book for 10 years. Absolutely love him, but I didn't really love like his diet. I don't know. I just have problems with some of the, like, asparagus is not my favorite food and stuff. So, but I launched into carnivore in beginning of this year. And within like literally 2 weeks, I noticed like the joint pain that I mentioned, the trouble going downstairs, upstairs was gone. I started to be able to stay awake through the whole day. Brain fog, basically dissipated. I was 173 pounds when I started it, which was my biggest pregnancy weight with either of my kids. So imagine, like, I'm not pregnant and I weigh as much as I did right before I gave birth. Like that to me was probably the hardest part of the whole vegan thing was they don't tell you, oh, you see all these really emaciated vegans, but I wasn't. I was fat. I was swollen. I've lost 35 pounds. So no, maybe more than that. I got on the scale this morning, it's 136. So, give and take. So potentially 35 to 40 pounds in like a matter of 6 months. My blood sugar is way more stable. I'm taking a lot less insulin. My skin's a lot better. I feel vivacious. I feel like I can, I sleep better. I didn't sleep well when I was on that diet, the other one. My whole world's different. And I actually love my food now. So that was the other thing they don't tell you is like no oil on a bunch of plants really makes it hard to eat all that stuff. So I was happy to have an excuse to let go of all the fruit, the vegetables, particularly fruits were hard because they're sweet. Mm-hmm. And so the sweet taste really made it hard to stay on track. And I was literally binging. I don't snack. I have two, maybe one meal a day, but for the most part, I eat two. And, but the biggest thing I think is that I can control when I eat. So I don't have to eat in the morning when blood sugar for diabetics is usually highest. Mm-hmm. I can wait till 4 or 5 in the afternoon. My blood sugar is maybe a little bit lowish. It's a great time to eat. So I don't know. My life is so much better.
Yeah. Well, I think this is a great topic. I love talking about this because I think diabetes is one of these conditions that we're still learning a lot about. And it's interesting, like when you were diagnosed as a late onset type 1 or an autoimmune type of diabetic, how did that present? Were you super high blood glucose? Did you have like polydipsia, polyuria, thirsty, going to the bathroom all the time? How did you diagnose that?
Yeah. So I had friends who encouraged me to test my blood sugar, and I was in total denial that I had blood sugar issues. Like, I mentioned I grew up, my dad suspected I was hypoglycemic. I was like, I'm absolutely sure if I grew up hypoglycemic, I'm potentially not diabetic, not recognizing that basically having a problem with blood glucose is an issue. Mm-hmm. It doesn't matter if it's high or low. Right. So I was having wounds that wouldn't close. I was irritable. I was drinking cold water all the time. I was going to the bathroom all the time. I was significantly I was like 110 pounds. So my ideal weight's probably what I am now. I was 110 pounds, and women have a kind of a weird idea about their body image. So I was like, oh, this is awesome. People would love to have my body, not recognizing that I was actually super sick. My skin was gray. Like it was bad. Like when I was actually diagnosed, we were on a marriage retreat for the military in Alaska. And I went to a ER that's probably about as big as my kitchen that I'm in right now. And they had to life flight me to Anchorage. But when they tested my blood sugar, it was 618. Ooh. And so, yeah. So it's a good thing, anyway, so that is basically what it was like. And I woke up maybe, I don't know how long later, I was sedated potentially. I don't know how many days I was in the hospital before I woke up, wow. But I had a bag of insulin attached.
Yeah. And so, because I want to, like I said, you go into the Mastering Diabetes program, and their goal is, under like 10 grams of fat a day. It's like super, super low. And even fruit has some fat in it. So you're like even having to watch how much fat you're getting in even bananas and stuff like that. And they tell you can eat unlimited amounts of fruit. Just eat as much as you possibly want. And the goal is to reduce your carbohydrate to insulin ratio. That is to say you need less insulin, you could eat more carbohydrates per unit of insulin. But as far as, did you find you were chasing a lot? I mean, did you find, because I know a lot of problems with carbohydrates is you're overestimating, underestimating, it shoots up high and then it shoots really down low and then you're correcting and then it's just a roller coaster. Was that what you were finding on that program?
Yeah, absolutely. There's nothing really more than needs to be said about that. I had literally had roller coaster numbers on my blood sugar, on my CGM. Like it was awful. And not to mention the fact that since you had to chase with carbs, you were just constantly pumping carbs in. And that also compounded the issue because I was getting more addicted to the carbs.
Yeah. Hey folks, it's Dr. ShawnBaker here. If you guys are enjoying these success stories, well, you can become your own success story. You can do that by heading over to CarnivoreDiet. You can sign up for a free 30-day trial and get started today. We're looking forward to supporting you. Our community is wonderful, and we'd love to see your success. Yeah, you mentioned the fruit, and I know a lot of people say, well, fruit is a whole food and it's healthy and we should eat it. Some people say you can eat unlimited quantities. I think like anything, there's a limit on that. For some people, it can be perfectly fine, even for some diabetics, to be honest. But, that sort of approach, I think, can be, like you pointed out, has some definite shortcomings. Not that anything doesn't have some downsides. But when you, when you were, like I said, how did you feel? I mean, because this is what, for people that don't know this, what does it feel like to go super high, super low? What does it physically feel like to you? What is that quality of life like when that's happening? Can you describe a high and a low?
Yeah. So when your blood sugar's high, it's harder to notice potentially. Although I would start to feel like the sweet taste of my mouth. So it's almost like you have so much sugar in your bloodstream that you can taste it. Wow. If that makes sense. Like it's really weird, but when it would get to be like 250, that's what it would feel like. I was more irritable. And then I would test, cause like they're always telling you, oh, well, don't test so much. I'm not really sure why they tell diabetics that. I was like, listen, I don't live for my meter. The meter works for me. I need the meter like when I need it. And, so then, you test and you get mad. I would get mad that my blood sugar was high because I was like, here we go again. It's because I would, and then they tell you, you have this protocol that you have to fit into that the doctors give you of like this much, carb to, insulin ratio when you eat and be sure you do that. But when you were stuck 2 hours later and your blood sugar was through the roof and you're like, well, I'm going to want to eat in 2 hours again. So how much medicine do I take right now? So it's this almost, you feel very defeated. I spent a lot of time. That's a good question. There's a question of, do I not have diabetes anymore? Oh, I absolutely still do. What I've noticed, I'll get to the blood sugar, to the insulin stuff, maybe what I'm doing now in just a little bit, but to finish this thought, like, I felt upset, defeated, frustrated, hungry. So it's kind of hangry, all the time. And then I work from home. I have kids. We homeschool. So I need to be like with it most of the time. When my blood sugar would dip, go basically bottom out, I'd be like, you guys, I can't talk right now. Like I really need to get a hold of my blood sugar. But then what would I have to reach for? More fruit, or like those sugar tablets, which I understand sugar tablets exist to help you, but it's frustrating to have to pull them out and use them, because you're like, this is straight sugar. I don't want to have to eat this. But it's really the only medication that's a good idea.
Yeah. I mean, outside of some people inject glucagon for severe, like if you're passed out type of stuff. And it's interesting, because I've heard, people talking, like some people, when they say they get really high, they start to get blurry vision and they get really tired and sleepy. And then when they get really low, you get sweaty and super hungry and you can't, it's almost like you're drunk. It's kind of like a combination of being a sweaty drunk or something like that. Which,
I've had times where I'm like, I literally can't even think right now. Like it's better for me to not say anything because I might regret it when I come to. It's very much, that is very much what it is.
And on on that, just to have a contrast here, on that, mastering diabetes, eat as much fruit as you want, super low fat version, did you have an idea what your A1Cs were and what kind of numbers were you seeing? What was the range you would see, lows and highs? How much was that? What were those numbers looking like?
Yeah. Well, and again, A1C is super confusing because you can say a low number and people are like, woohoo, good job. But it's the fluctuations that's a problem. So I was having good blood sugars. I mean, I think my best A1C on mastering diabetes was like 5.7, which is okay.
That's at the edge of prediabetes. So it's not, it's a non-diabetic blood glucose. So that's not bad.
Yeah. But my fluctuations were literally between like LO, which is like unreadable, which is probably under 40 to like 300. Or 320 or something. Yeah. So the fluctuations were terrible.
And just as a frame of reference, how much insulin were you giving yourself per day in units? Like I'm probably a basal bolus fashion, I imagine, but what was the total on it?
Yeah. So the total number of units per day I was taking on mastering diabetes was probably 40. I mean, I've always been able to manage with like not much insulin. Right. So but it was like basal was like 17 and the bolus was like 23 to 25 or 27. And my doctors were mad at me because they're supposed to be about equal. If you take 17 units of basal, you're supposed to only use 17, or at least that's what they would tell me. And I would again say, well, listen, like the medicine supports me. I don't work for the medicine. Like, but that was, they would kind of, because they have to ration it. I don't know, like it's TRICARE. So I'm not really sure why, but that would often get my finger shaken at me because I was constantly taking more bolus than basal, and they didn't like that.
Interesting. Yeah, that's interesting. And then there's that's interesting. There's a study that came out recently looking at total insulin usage and cancer rates in type 1 diabetics. And the more insulin you use, the higher rates of cancer. Type 1 diabetics in general have a higher risk for cancer. That's just the facts of life. But as your insulin requirements go up and up, or utilization going up, the cancer rates go up significantly. So it's something that, it's a concern. So let's contrast that. So unreadable lows up to, 200, 300, 250, 300. And so you go to a lower carb. Did you go straight to carnivore? How did you transition into that?
No, I did go to keto. I went to keto first because I saw a couple of carnivore videos. And at the time, I'm sure we can all relate to this. It was a little bit of cognitive dissonance. I was like, how do people really just only eat meat? And so I went to keto, but I discovered with keto, I had the same issue I did with mastering diabetes. There were still carbs in there, even though they were plant-based. I tried to eat really, really clean keto, right? Just whole foods. But I was still having trouble, especially with the nut butters and the fruit, because nut butters for me, like, just did not work. And, I have since found out, I talked to my endocrinologist and she said, well, she used to be a nurse. She said they would actually give diabetics peanut butter in the ICU when they would have extreme lows. And I was like, oh, well, that's like the worst food for me to eat. But unfortunately, it was like an addictive thing. So I moved to carnivore when I was literally like, listen, I have to get a hold of this, because even with keto, I was still finding I was not, maybe not as much, but I was still chasing my blood sugar to some extent, having to try to get it down or pull it up or whatever. And I was like, I know enough to know that, like, carnivore, I listened to you. First video I listened to was by Dr. Barry. Then I found Dr. Chafee, and I'm like, I keep telling people, I'm like, listen, there are a lot of doctors out there talking about this. Like, you don't have to get it from just me. Like, there's a lot of information out there. So I started that earlier this year. And that was actually, so I had a slide. I went from mastering diabetes to keto to carnivore to answer your question. Sorry.
Okay. And as like you said, I think keto can be great for a lot of people, but there are potential issues with keto as well. Particularly, there's a lot of ways to do it. You can do it on pure junk food, quite honestly, and I don't think it's particularly helpful. So you make the transition to carnivore. First of all, I assume you have an endocrinologist, or do you have a primary care physician managing your medication? So endocrinologist. Does he express any concern as you go to these different dietary schemes? Is he pumping the vegan style? Is he saying whatever, or does he just kind of say it doesn't matter? Just slam a bunch of insulin in?
Well, I mean, to be honest, being military and moving several times since I got diagnosed, I just kind of tell them what they need to know.
Got it. Okay.
I only answer questions that are asked of me. I don't say this is why I'm eating, because when I was first diagnosed, I went to a diabetes education seminar through the military at the facility we lived at, and they literally lambasted the ketogenic diet, and carnivore wasn't even mentioned. But one of the other patients in the education room asked, well, wouldn't it be a good idea to go on a low carb diet? And got publicly shamed in front of the whole class. And so I was like, well, that put a really bad taste in my mouth for wanting to tell people, like, well, I eat in a way that makes sense for my own body. And, I found something that works. I'm like, listen, I just take my numbers in, I take my CGM, I show them my stuff, I tell them how much insulin I'm using. They're like, oh, your A1C looks really good. We'll see you in 6 months. And I'm like, okay. And I just leave because I don't really want to tell people much. And maybe that's good, maybe that's bad, but I don't really feel like my role as a patient, at least with the people I'm dealing with, is one to educate, because I've also dealt with the whole, well, I'm the doctor and you're the patient.
Yeah, it's unfortunate. And to be honest, I mean, I learn a lot from my patients, particularly things that there was a meme going around about, don't confuse your Google search with my 6 years of medical training. And the other person says, don't confuse your 1 hour lecture with my 30 years of living with this condition. And so you get a lot of insight because you have so much skin in the game. I mean, you're like any person, if you have this disease, you're like, I want to know everything about it. And
absolutely.
I think you find out what works for you personally, whether it's extrapolatable to the entire population, is really irrelevant when it comes to your standpoint. I do encourage patients to let their doctors know, because I think more doctors do need to be educated. I'm doing my best, and doing this interview, like we're talking about, somebody's going to watch it. Somebody's going to be a healthcare provider or something like that. So we're getting that information out there. So now you're on carnivore. What does it look like from blood glucose control? What does it look like from insulin utilization? What's going on with that now?
Well, what I didn't mention that is super cool that I'll throw in there is that last time we did about a year, we did my labs. Last time we did my labs, the clinical pharmacist that I was dealing with at the time actually noticed that I had beta cell activity, which was super interesting. And so basically what that means is that I'm sure you know what it means. I'm just going to say it. Sure. You can tell me if I'm right, but the pancreas is actually potentially working, even if it's just a little bit.
Right. Yeah. We know that even in long-standing type 1 diabetics, even 30 years or more, they do still have some beta cell activity. That's seen.
Yes.
Is it enough to get you off insulin? Probably not for most, right?
Yeah, not for most, but it's interesting because at the time she was like, we should try you on some type 2 and see if it, medication, see if it helps. So that's been something they've been kind of working through too. Right now, so I'm trying to figure out where to start. Maybe I should start with how many meals so you can kind of place them in the day. So I'm at the point now where I eat 2 meals on average per day, actually maybe 1.5 per day. Some days I eat 1, some days I eat 2. Usually I work on waiting till like 3:30 or 4 to eat. And I do the beef, butter, bacon, and eggs type approach. And that really works for me. I've found out that I do best not consuming heavy cream. I have to tell myself that I am drinking coffee. I still love my coffee. But I put like egg whites in it. And I got that from somebody and I was like, that's super interesting. So I do that now instead of heavy cream. I usually have a steak with, I love bacon and butter, and eggs is more of a, like a dessert or a condiment or something. So I have eggs, and I know I should probably have eggs a lot because eggs actually have the hormones in them that are good for the females, medicine wise, I take 10 units of, 10 units of basal insulin in the morning. And I find that really helps me. And then I take another 4 at like 3:00 in the afternoon. And for me, for whatever reason, I found that really works. And then I take, I actually have gotten to the point where I don't see or notice much Dawn phenomenon in the morning, which is super interesting to me because it's actually really nice to, and I mean, I don't even have to walk to get my blood sugar to stay normal. Obviously it's great if I do, but, I don't have to chase my blood sugar in the morning with bolus type insulin. And so, I take probably 10 units right now of bolus insulin to deal with blood sugars during the day. Yeah. And that's kind of a max. So, I mean, it went from on Mastering Diabetes, like 40 to 45 units a day to 24 to 25. And so even just in a few months, like that's not even a year. And I'm not necessarily sure if I am trying to get off medication. Again, my goal is just to have normal blood sugars. Sure. But I looked this morning and, in the last, I used to have probably 60 to 90 lows in a 30-day period. Mm-hmm. And now I have 30 lows in a 30-day period, which actually for me is pretty good. And that's it's front loaded 4 weeks ago. This past week, I've had 3 lows.
Yeah. So coming down.
So for me, yeah. And a low could be 58 now. It's not 30. Got it. Right. That also for me, that makes a massive, because I can function at 58. It's not ideal, but, the blood glucometer doesn't differentiate how low your lows are. Yeah.
And just to be, there are people that function fine in the 50s. I'm not promoting everybody does that, but it's relative, particularly if you're producing more ketones, you tend to do that. There were studies done in the 1970s and 80s showing that very clearly you get people very low glucose and they would function well if their ketones were high enough. And so it's interesting. So the lows are not as low. The highs are certainly not as high. You're using about 40% less insulin, which, I think arguably would be a good thing. Now, the thing that really, I think the important thing, and I don't know if you have enough, you probably don't have enough information on this, is the reason we care about diabetes and their blood glucose regulation is we don't want to see the end organ damage. We don't want to see the retinopathy, the nephropathy, the cardiovascular disease on that stuff. So are you following, because most diabetics are checking their eyes once a year or something like that. Have you had enough feedback on that stuff yet to see if that's getting better? Because I've seen now, which is, the sort of the plant-based critics will just say this, well, you're just masking the symptoms. And if you ate a bunch of sugar, it would still go high, which is well, maybe I don't want to eat a bunch of sugar. And I always laugh when they talk about the oral glucose tolerance test, because it's a 75-gram slug of pure glucose, which you would never in the world, ever in the wild, ever have been exposed to. Humans would never go up to the glucose tree and eat a 75-gram bolus. It just doesn't exist. Even if you're eating a decent amount of fruit, that's hard to do. Because it's cut with sugar, it's cut with fiber and fructose. And so pure glucose is really not something we've ever as a species been exposed to at any point. So I wonder about that test. But, as far as, like I said, this is the thing that really, at the end of the day, we want to prevent complicated. Like you mentioned, I want to keep my fingers, I want to keep my toes. What is your A1C? Have you had a chance to do an A1C yet?
Not since I started Carnivore. Okay. Right before I started it, when I was finishing keto, it was 6.6, which I wasn't super happy about. Mm-hmm. I would have expected better. But I can't wait to see what it is. I could show you my chart. The nice thing is I did change my CGM. My band is 70 to 115. So I'm actually really working to keep myself in a normal blood sugar range. Okay. And, it's actually pretty close. That's,
I'll just comment that the American Diabetes Association for type 1 diabetics recommends a band of 70 to 180, which is, you think about the amount of potential damage you're getting there. And, we know unequivocally when people have higher A1Cs, 6.5 and up, something like that, the rates for blindness, amputation, cancer, heart disease, everything has gone up significantly. So those numbers are not, I don't know why they have those numbers so high. I know they're terrified of having lows, but still.
Yeah, it's almost to offset it with, it's okay if your blood sugar is 180. We're really not concerned until it's 200. That's not really okay, especially when you find out you could do all that damage. And Dr. Berry was the one that really clued me into tightening that band up. I was like, listen, this is my life. And he was like, there was a video he did that he was like, 130 is not even really that good. And I was like, oh my gosh, I've been conditioned to think 130 is great if you have diabetes, and it's to find out it's actually not. So you asked about progress as far as macular degeneration and all that stuff. So I'm sure that they really kind of only do a pass fail type thing. You go in there, they prick your toes and stuff. And I've always, been able to have feeling in my toes and fingers. And they've always looked at my eyesight and been like, well, you don't have any evidence of macular degeneration. So I don't have a way to really know if it's progressed. Except for my raw numbers on the CGM. That's it. I can just kind of hope, just along with everybody else, that my eyesight's good if my blood sugar is good.
Yeah, I think they're looking for often diabetic retinopathy, where you get the visual examination. And I have seen now, like I said, I've seen quite a few type 1 diabetics especially see their diabetic retinopathy and their eyesight get better, which to me is more than just masking the symptoms. You're actually reversing the disease. And I think the people out there that are critical of this are saying, you can't pass an oral glucose tolerance test. But I'm saying, well, look, these people are actually, not only are they off medications, they have very nice glucose control, but now they're actually seeing a reversal of this. And it's interesting, David Unwin, who is a physician in the UK, which will be, I think we're interviewing David next month. Great guy, but he's seen with type 2 and, well, certainly type 2 diabetics, a reversal of nephropathy. So the chronic kidney disease is getting better by putting people on low carb diets. And some of them are probably meat based. We'll talk to him in more detail about that, but it is a very interesting thing.
Yeah, I will say that when I was doing Mastering Diabetes, I had reports then of spill over into my urine and stuff like that. So back at that time, 4 years ago, I had a concern that I could end up on dialysis or something if I had continued along the path that I was on. I'm not going to say I would have for sure, but there was definitely a higher, I don't have that concern now. Mm-hmm. I don't know. I know that a lot of pro plant-based diet people say, well, you're just masking your symptoms, but I can't argue with the fact that not only do I feel subjectively better, but I do have objective numbers to say my blood sugar's in so much better control now, and I have the presence of mind to actually enjoy life, so.
Well, and I think this is something that we seem to lose sight of for some reason with physicians. They don't seem to take the patient's concerns into account, like quality of life. It's so much, I cannot tell you what people have asked them. Look, you're off your diabetes, you're off your diabetes meds. Maybe your depression's gone. You're off those meds. You're off your Crohn's disease meds. Your guts feel better. And, and that's important to them. And I said, what if your cardiovascular risk has gone up 10, 20%? And most of them say, I don't really care because I want a quality of life. And, if I'm going to die of something anyway, who are you to tell me when and why when I'm supposed to die or what I'm supposed to die of? Like I said, for some people, dying of cardiovascular disease is better than some other alternatives. Some people are saying, I'd rather die of that than, whatever, neurodegenerative disease or stroke or who knows what it is. So interesting. As far as your meal, you said you can eat infrequently. What is a typical day of, you kind of mentioned some of that, I think, about what you're eating. What does that look like again?
So I do typically wake up in the morning. I enjoy a cup of coffee. That's kind of more of a spiritual habit I've developed that I really enjoy, but I do, bulletproof it. Carnivore, I don't use MCT oil anymore or anything like that. So I'll do that. I usually have a couple cups of coffee, but then I don't think about things. It's even kind of gotten a little funny because I am the mom of the family, so I'm supposed to make food. And I've gotten to where I'm oh, it's time to eat. Oh, I have to make food. I don't remember. But I usually do my daughter's actually, she's 16 years old. She has no physical conditions at all, but she's jumped into doing carnivore right along with me. It's super fun because that was her choice. But typically about 4:00 in the afternoon, she and I are both in the kitchen making eggs, taking some bacon or making it up, the first time of the day. I'll usually have a steak. And, since I started doing it in 2022, I have decided to move away from ribeyes for now. And I use chuck steaks and cut them down, or chuck roasts and cut them down. That was a tip I got from someone, but I'm literally putting money back in my budget to get ribeyes because there's nothing like a really yummy ribeye, but I'll have that. It's amazing with butter on top. Because the other thing that I have realized is that we haven't even talked about female stuff. I've got some stories there as well. But women need the butter, the hormone, they need butter. They need butter. We need butter. And so I have consumed a lot of bacon fat and a lot of butter. I save all our bacon fat and I use it any way I can. sometimes I put that in my coffee in the morning instead of butter, and I actually really don't mind how I've gotten used to how it tastes. But I'm 52 years old, like I said. What I will throw in, and yeah, I know that the women's cycles of life are kind of a normal progress, but let me tell you that at 52, I was off my cycle probably for about 2 or 3 years. Really kind of went through that, like it was kind of a, really bumpy ride, and then it just stopped. And then a couple months ago, guess what pops back up? And to me, like I've done a lot of research. I don't necessarily think it's a bad thing. I think it's healthy to have your cycle. And even though I may be chronologically 52, it's kind of exciting. Maybe I'm just making this up. Maybe it just makes me feel better, but almost a sign of a fountain of youth, sort of, that has popped back up. But I think it's because of the consumption of all the fats. And yeah.
Well, we know that, obviously the hormones are fat-based hormones, or they have a cholesterol on them built on a cholesterol backbone. And I've seen that, and like I said, and whether or not, clearly women are supposed to have a monthly menstrual cycle. That's clear physiology. And when that goes away, somewhere in that late 40s, mid 50s, something like that. So, but it's interesting to see when you restore the nutrition, you start to have this normal cyclic, and it's not just dysfunctional bleeding where you just have random. So it's a more normal menstrual cycle, correct?
Yeah. And I hope that's not too much information for folks, but if this is a medical call, like that's actually what's happened to me. And I just, I believe in sharing the story because, to me, it almost does say the body's healing. I don't care if it sticks around, but there's a part of me that's like, to me, that's a good sign, because I have also had lots of friends who eat a plant-based diet who have said that they have lost their cycles, and they're usually in their 20s or 30s. And I'm like, that can't be good for you. And so for me to see it come back, I'm like, I'm actually kind of thrilled. But that was another thing, because of course, when you have diabetes, they look at your cholesterol,
right.
And where I'm going to go with this. I've always had normal cholesterol. Even the whole time I've had diabetes, they've had it like a microscope on my numbers. But they're going to offer you statins, even if your numbers are normal, because they tell you have stricter control and all these things. And I'm like, no, thanks, no, thanks, no, thanks. And again, I can't wait to get my next A1C done, because I know that they'll do my cholesterol numbers too. And I can't wait to see what they are. And I can't wait for the opportunity to talk with the provider about, the fluffy, particles and things like that. Because I've learned so much, following you guys and learning a lot about it. But cholesterol is like the building block for all the other hormones, as you said. And so, like, I don't know. I've never felt better. I've not felt better in literally probably decades.
Right. And that's, again, this is a very nuanced and complicated topic, to be honest. And, like I said, I think that, the larger particles being less atherogenic, and that's, that tends to be the case. Although some people would argue that they're bigger and have more cholesterol, and then when they do stick, they're going to put more cholesterol down into the potential plaque. So it's a very nuanced conversation. And I think the important part is, you do feel good. And ultimately at the end of the day, where the rubber hits the road, I think it's the imaging will ultimately tell you the true answer. The risk factor, I think, people will say that as our ApoB particle count goes up, our risk has gone up. And then you put the caveat and it says, well, all things being equal, that it may very well be true. However, often all things aren't equal. And then we're saying, well, what are the things that are mitigating my cardiovascular risk? Is my diabetic glycemic control improvement mitigating diabetes risk? And I think most people would agree, yes, it is. And so it's kind of like, where does it fall? Did you increase one risk factor, but you decrease several others? What does that overall affect? There's some people that are just all thing, they're very myopic, and the only thing that matters to them is LDL cholesterol, and not even ApoB. They're not even that nuanced. So interesting, and I like I said, there very may be a chance that your total cholesterol has gone up. And then you're in this question, this is a quandary. What do I do about this? Do I go on medication? Do I change my diet back to a more plant-based diet? That's your decision to make. I can't make it for you. I can just say my advice for that situation is, probably start looking at imaging. And, I've seen, I can't remember, I just talked to another person today, high total cholesterol. So he went and had a cardiac, he had a angiogram, diangiogram,
Oh,
and it showed
mhm.
perfectly clean arteries. And it's like, well, there you go. I mean, there's no better answer than that, as
Yeah.
far as what's going on currently. And then you just kind of monitor it over time. Because you're right. I think, it's like, we just have to, we cannot just, and I know I'm sort of doing a soliloquy here, but I mean, we can't just ignore a patient's quality of life and what they want in order to fit everybody in a box. And I think that's an important thing that I like to
Yeah.
share. So anyway, sorry. So let's talk about as far as, your blood glucose is better, you've lost some weight, your cycle has been better. Anything else that you've noticed beneficially wise, like cognition or mood or any of those types of things?
Both. Yeah. I would say historically, I've in the past dealt with depression and anxiety. I've had medication 20, 30 years ago. I got to the point, like I said, under the plant-based diet when I was having trouble with brain fog, big issues with fatigue. Those have all alleviated. And like, it's not uncommon for me to have just, kind of like the Energizer Bunny type energy. And as someone who's dealt with the fatigue for several years, especially with small kids, it's a relief. Well, my kids are bigger now, so they're more autonomous too, which is a little bit, I get two leases on life at the same time because I have like energy and they're doing their own thing. But yeah, both. And I would say, depression, anxiety hasn't been an issue in a few decades. However, I could definitely tell my mentality's better. Adverse events will happen and I am less rattled. And I think that's huge. Because I mean, literally, I was the kind of person in the past that you blew on me and I was like, freaking out over in the corner. But literally, that has not been an issue. We've had some significant things, adverse events happen in the last. I mean, my daughter totaled my car on Saturday.
Yeah.
And I'm not going to say it was like I was lackadaisical about it, but I was actually like amused that I was like, we'll figure it out, but that was such a relief. So,
well, I mean,
I
assume she was okay. No one got hurt. I hope that's,
she and my husband are both fine. Okay. Yep.
She was driving. Your husband was in the front seat with her, and she was.
Yeah, it was a learner's permit situation.
Yikes.
Yeah. So, but again, it was like, that's okay. We'll figure out a way through this. And it's nice to know. And literally all of this has been in the last 6 months. The only thing I've changed is my diet. Mm. I've not changed anything else, but it was like it was an open door to a lot of things that shifted. Yeah, to the better.
So like you're a person who's clearly experienced a benefit from including more meat in your diet. Now we have this sort of narrative that you can't escape this, that we should all be eating less meat. It's going to save the planet if we cut back on meat. How is that going to work? How's that going to play out for you personally?
I think that is the one time probably in my life that I do have a little bit of anxiety because I'm like, you sit there and tell a diabetic, right? Every single piece of plant matter has carbohydrates in it. I mean, that is what they are. Mm-hmm. So you sit there and say, well, the only thing you're going to be able to eat, you will eat no meat and be happy or whatever. And literally I'm like, no. The other thing is I've got a lot of friends who are farmers, ranchers, and they're on the provider side of things. And they're like, what? And of course I get the whole logistical background for them about how much more beneficial it is to raise livestock and, consume that or whatever. And my in-laws, my father-in-law is a retired dairy farmer and he plans to slaughter a cow this fall and, get it processed and split it among all of us. And that to me is almost a little bit of like, oh, that's how our ancestors lived. I think they have a garden. They eat vegetables, but they grow them. They eat what they grow. But especially as someone who deals with diabetes, who knows, it doesn't matter, all those carbs break down into glucose. And if I know I have a glucose intolerance, it incenses me that, there are people out there that want to push this, vegan, the only way you can eat is plant-based, because I'm like, no, that does not work for me. I have a life of that. And I can show you what it's done to me. And I don't want to live that way again. Yeah. I don't. Yeah. And I'm sorry, crickets are not animals. I don't need to eat crickets and, whatever bugs either.
Yeah,
No,
that's
just no.
the sort of you could see the palpable intensification of the push to get everybody eating bugs and how wonderful they are and how they protect you from cancer and all this, clear, clear narrative push to drive us all into the bugs. It is a little bit concerning and stuff like that. And so hopefully we'll be able to continue. And I think we have to speak up and say that these are, not only do we prefer to not eat bugs, but it's also eating meat has been beneficial to our health. And I think that's an very important consideration that we have to fight for. So, are you doing any social media type stuff? Or before we go into that, let me ask you, how does the family, the immediate family, the husband, the kids, what are their thoughts on mom's eating a bunch of meat? Is she crazy? Or what is the thought on that?
Well, I think my family's used to me kind of going on these wild goose chases for the last decade or so. Because like I said, my goal has always been to have healthy blood sugar. So I'm always doing something, in their mind. But so it's interesting because now I think my daughter, like I said, who has started to move towards carnivore, and she's now calling herself, ketogenic, which I think is just a massive move in the right direction on her part. She's primarily meat-based products. She's like, she'll do whatever I do. I mean, honestly, she's just so sweet. I just obviously love her. But my son and my husband's, like I said, he did keto back in May. He had he had a weigh-in and he wanted to weigh a certain amount. And so he said, well, I'm going to do keto for 30 days. And I was like, just 30 days? But I'm like, our relationship is such that I'm like, he's an adult. He can make his own decisions. Like, and to make a really long story short, we're geo-batching right now. Like he actually has an assignment somewhere else. So he's not living here. Like it was actually a PCS move, not a deployment. So he is able to do his own thing, eat his own food. He, really just only has to deal with it when he comes home. But I would say for him, the biggest thing is I hand him like literally 10 pounds of meat. And I'm like, please grill all of this. And he's so gracious. And he's like, okay, a couple hours later, he comes in with all this meat and I'm happy. My son, he was the one that I had all the, craved pizza with. I would say it's harder for him. And, that's where it's challenging. As parenting is challenging anyway, but knowing that the best thing for him is to eat a certain way and knowing that his body at least is exhibiting signs of craving the wrong stuff, kind of like I did when I was pregnant with him. And that is, that's an issue, because that has to do with, it bleeds into a whole lot of other issues. How do you parent? How do I raise him? Do I, put the iron fist down or, do I say that you're supposed to eat this way or whatever? So we did an experiment with him on clean keto, from like March to July. And we really only got off it because he took a trip to my in-laws. And my mother-in-law cooks, your farm type breakfast with like pancakes and eggs and bacon. And, the eggs and bacon are great, but it's got pancakes, and he goes there and he's like, he's a kid. He's not going to limit himself. So the biggest issue has been to try to figure out how to help him. My husband, like I said, he's an adult. He can make his own decisions. I obviously have preferences. He knows what they are. But he also can eat the way he wants to 5 days a week. And then really only deal with me when he's home on the weekends. My son's the biggest issue.
Well, I think, with kids, I think it's so important to provide them good nutrition and also educate them on what that means. And, like I said, whether they go carnivore or something else is kind of irrelevant. But if you give them the tools, like my kids, I taught them how to read labels at the beginning. And, there's just a lot of crap that they put out there that, I know there's processed food defenders, and some of the, not all processing is bad, but there's a lot of junk out there. There really is. And there's stuff that no one has any business eating, quite honestly. And I will say that there are bad foods. There are complete garbage that none of us need to eat. And, certainly not with any regularity. And there's people that live on that stuff. You look at a lot of the food in the grocery store and it's there for a reason because people keep buying it and eating it in massive quantities. You can, you go to the grocery store and you see what people's carts and you're like, there's no nutrition in this stuff. And it's like,
No.
liter bottles of Coke and Pepsi and cookies and crackers. And it's like, and then maybe they'll have a couple eggs in there, a few pieces of fruit. And they're like, this is not good. So you got to teach those kiddos and provide them. And my kids, I don't have a hard time get them to eat meat. They love it. And they're like, here you go. And I put that out there. Eat up that stuff. And if there's something else you want to eat after that, go for it, but at least get the quality nutrition down your gullet first, and then you can go from there if you're still hungry. Saves on cooking too, because if you have kids that are on this high carb constant snack thing, I saw a lady putting out she called it her Snackle box. It was a fishing tackle box loaded with gummy worms and granola bars and cookies, and it was just loaded. So it was more convenient to have that available ready for you anytime you need it. And really the point should be feed your kids a nice nutritious meal. They don't want snacks. That should be a goal. And I was, anyway.
Yeah. And a lot of it's illumination too. Like since my son came home from my in-laws and has been, craving more carbs, I've mentioned to him, hey, did you recognize you actually didn't ask me for snacks when we were eating keto? And he started to scratch his skin again. He's been dealing with eczema since he was a baby, and he started to scratch his skin again. So it's just like exposure. He's getting older too, kind of like my daughter. My daughter chose to eat keto. My son, I'll keep helping him see that. And we do that a little bit of like, the kids came with me to the commissary. We had a similar conversation about other people's carts, like not around those people. Like we would drive away and like say, well, gosh, did you see anything in that cart that was actually nutrition providing? And the kids were like, actually, no, and I was like, that's how a lot of people eat. And actually even it gets in right now to economics. I'm like, we haven't even scratched the surface on the economic benefit of eating carnivore. Right now, especially people notice it. It doesn't even matter. The eggs have gone up 3 times, in price. They're still way cheaper than like a box of donuts or something, So just even the conversation with the kids about how they don't have to eat as much food, but they're going to get the same amount of nutrition, or even more, by eating the animal-based product. Like, my he's smart enough. It's what we all deal with. Like we know it. And then it's just a matter of working it out. And I think that's where, he's going to have the biggest opportunity to figure it out. But I'm also trying to raise humans that can make their own decisions. So,
yeah, it's interesting because you mentioned the scratching and the eczema. That's something that a lot of people, it's something I noticed, I never have hiccups. I never have to itch myself. You don't bloat, you don't burp, you don't fart.
Right.
It's all those things you're like, well, wait a minute, maybe those things aren't like normal. Or maybe we're not supposed to be doing all those things. This is weird things that get better. That improve that you didn't even think about. And it's really an interesting thing that you just kind of notice that, like, why am I scratching myself? Why am I itching? Why do I have dry skin all the time? Why do my guts always bloat? And you're just kind of like, wait a minute, food impacts that stuff, right?
Well, yeah. And now if I notice that I've done one of those things, I'd be like, what did I have today that might've not been clean or something? You sit there and ask questions about like, did this thing that I had at that event have cream in it or sugar or something? Or grains, you can start to notice the outliers. Yeah,
for sure. Yeah, it's interesting. Well, we are unfortunately running out of time. Heidi, it's been a pleasure chatting with you. Are you doing any like social media stuff that you'd like people to be aware of? Don't feel pressure to, but if you are, we'll let people know about it.
I do appreciate that. So I'm on YouTube. I do have a few carnivore videos that I've done. I'm really trying to get out there and do more of those. As Heidi Hovan. It's just same as my name. I'm on Instagram as simply Heidi Hovan. I don't necessarily, but really the place where I do more carnivore discussions is on YouTube. So I would probably say that's the primary place that people can find me for carnivore stuff.
Yeah, I know it's funny because I see a lot of physicians out there, the mainstream physicians, the ones that are pretty much into the algorithm, and they criticize people. Well, there's stupid people on YouTube and Facebook sharing their stuff. They're not scientists, but there is some utility in real people discussing their results. And I think that's important. Maybe it's not perfect science, and some people don't, sometimes they say things that maybe are incorrect, but at the end of the day, it's like, what do we care about? And like you said, I want to feel healthier. I don't want to have hypoglycemic episodes 90 times a month. And I don't want, I don't want to feel miserable. That's
no way to live.
There's nothing wrong with that. Keep doing what you're doing. I appreciate it. Anyway, guys.
Thank you, Dr. Baker.
Thanks for being here, Heidi, and the rest of you guys. Think you. I think I'm going to actually, I'm going to be gone for a while, guys. I'm heading out I got to go to Europe and stuff. So I won't be able to be doing this stuff for a little while. So I'm sure you guys will suffer along fine without me. Probably have a lot more fun without me here, but anyway, guys, you guys have a great day. Heidi, thank you so much. The rest of you guys, we'll see you soon. Okay. At some point. Bye-bye, everybody.